Hi, welcome to Stop the Inflammation Pandemic series. I'm Anjela, holistic medical herbalist. In our last video, we explored the vital role of lymphatic system, our internal drainage and defense network. When it becomes sluggish or inflamed, toxins build up, fluid retention increases, and immune function weakens. We saw how supporting lymphatic flow helps reduce inflammation throughout the body, including in areas like the scalp, under eye, and pelvic region. And now we are ready to take a closer look at how inflammation in the female reproductive system can lead to conditions like PCOS, endometriosis, and chronic pelvic infections. Let's explore how inflammation in the smooth muscle lining of the reproductive organs contribute to common yet poorly understood conditions like polycystic ovarian syndrome, endometriosis, chronic pelvic inflammatory disease, recurrent Candida, which is a yeast infection, bacterial vaginosis. The female reproductive system is lined with mucous membranes, delicate, moist tissues where both good and harmful bacteria live in balance. But when this harmony is disturbed, often by infections, antibiotics, hormonal shifts, or physical emotional stress, the immune system is triggered. If that immune response becomes chronic, it leads to inflammation of the smooth muscle lining, which can disrupt ovulation, affect menstrual cycle, trigger a hormonal imbalance, lead to infertility, cyst formation, and abnormal tissue growth. Knowing what's normal is the first step towards recognizing when something isn't. So, a healthy menstrual cycle includes cycle length 28 to 35 days, bleeding duration 4 to 7 days, heaviest bleeding typically days 2 to 4, mild pain and small clots on heavy days is normal. Irregularities to watch for: spotting before or after periods, bleeding longer than 7 days, no period for more than 35 days, or periods every 2 or 3 months, or only spotting. Severe pain, especially if it stops daily life, large irregular clots. These signs often point to underlying hormonal or inflammatory imbalances. Early detection and gentle herbal support can prevent progression into chronic conditions. Let's look at some case histories to understand this better. An 18-year-old girl came to me with irregular periods. She'd always had regular 28 to 30-day cycles with manageable bleeding. But over the past year, her cycles stretched 40 to 45 days, bleeding became very light, and she gained significant weight. She also developed hyperpigmentation on her neck and underarms. Her lifestyle had changed drastically. Intense stress from her A levels, poor sleep, excessive coffee, and late night studying. Her symptoms pointed to adrenal fatigue and ovulatory failure, triggered by chronic physical, mental, and emotional stress. So, the treatment involved supporting her ovulation and adrenal function, reducing inflammation, and enhancing lymphatic drainage. After 2 healthy cycles and visible improvement in her skin and weight, she was able to stop herbs. Today, she is studying music, something she truly enjoys, and her cycle remains regular. What's the takeaway? When your lifestyle aligns with your joy, your body finds balance. Let's look at another. A 35-year-old woman had suffered for over a decade with 10 to 12 days heavy bleeds, large irregular shaped clots, constant pain except for 1 week a month, pain during urination and bowel movements, premenstrual digestive upset, emotional swings, sadness, anger, irritability. Despite surgery and hormone therapy, her condition worsened. She was on morphine and housebound, needing constant support. With targeted herbal treatment focused on deep anti-inflammatory healing, restoring cycle rhythm, and addressing emotional trauma, She experienced a transformation. After a year, her cycle was 6 days long, with only 2 days of manageable pain. She regained her independence and she is now preparing to start a family. What's the takeaway from this? Even severe cases like this can heal with time, the right herbs, and a whole person approach. For those preparing to start a family or aiming to restore reproductive balance, here are 3 powerful herbal combinations I recommend. Shatavari Complex contains herbs that strengthen the uterus to support a full-term pregnancy, optimize ovulation so a healthy, mature egg is released every cycle, tone and strengthen the entire pelvic area. Marshmallow Root Plus, reducing inflammation in the smooth muscle lining throughout the body, healing and toning mucosal tissue, enhancing tissue integrity and resilience. Barley Grass Plus, a vital addition for cleansing the system gently, supporting the liver in breaking down and removing excess circulating hormones, promoting hormonal balance and detoxification. For optimal results, take these formulations for at least 3 months before trying to conceive. Pair them with a multi-nutrient dense whole food diet and cultivate a joyful mindset. Ladies, know what's normal. Help your daughters know too. Awareness is prevention. Please do not self-medicate. Herbs must be tailored to your unique situation. Work with a trained holistic medical herbalist who can get to the root cause. Our female bodies are miraculous, designed to create life. Let's honor and care for them so that the next generation begins life in a healthy, balanced space. Thank you for watching. In our next video, we will explore inflammation in the male reproductive system. Stay tuned.